see patients of all ages, from infants through the elderly population. So we offer anything from pediatric patients with developmental delay, congenital abnormalities, neurological disorders, of course orthopedic injuries, through middle-aged people with just low back pain or work injuries, arthritis, post-operative conditions, and then through the elderly, Parkinson's disease, poor balance, falling, neurological conditions such as stroke. So really we see everything across the spectrum with all ages. So in both locations, in our Belleville and Shiloh locations, we offer physical, occupational, and speech therapy services. And we really work, all disciplines really work really well together. There are some conditions that require 2 or 3 of those services, and so we're able to offer at both locations all 3 services that are needed for patients, and we do our best to make it so that they can have their appointments consecutively, so they're not making multiple trips to the clinic or having to come on multiple days of the week. So we really work at making it convenient for the patient and their family to come to therapy. One example would be our total joint replacement patients. They will come to physical therapy for a preoperative evaluation that gives us an opportunity to assess them, see maybe what things they can work on prior to surgery, prepare them for what their therapy will be like after surgery and also in the hospital. So they have an idea going into their surgery what to expect and what to expect from a therapy perspective. Once they're in the hospital and they have their surgery, we are working with them the day of their surgery in the majority of cases. We have them start to mobilize. Mobilizing immediately after surgery reduces a lot of complications, so that's very important. At each stage of their recovery and their rehab process, we are able to coordinate and communicate with each other at each level of care, whether that's in the hospital, an outpatient, so that we can follow that patient along the way and work to their individual needs to help them reach their goals. I can't say enough good things about our team. We have what I think is the best team in the area. We have therapists who have been in the field for 20, 30, even 40 years. In some situations, they bring all of their experience, and yet we have some therapists that are newer to the field and maybe been practicing for 5 years. They bring the newest technology, the newest ideas for treatment. So we're a perfect blend of experience and new ideas. Our physical therapy clinicians work with our occupational therapy and speech therapy clinicians. Again, we have patients that need 2 or 3 services at times. We're constantly communicating what does that patient need, what do we need to do to help them meet their goals, collaborating with treatment. In some instances, it's appropriate to do what's called a co-treatment, and we work together with that patient if we're trying to address the same goal and work together to, again, achieve those patients' goals. We had a young lady who was in a car accident, a very severe car accident that resulted in a head injury for her. She came to us again for physical, occupational, and speech therapy services. She was very dedicated, always at her therapy, 3 days a week, working very hard, and her goal was to walk across the stage at graduation. She worked so hard at that goal, and ultimately, with the assistance of some of our staff who joined her at her graduation ceremony, she was able to walk across the stage and graduate from high school.